Mitrofanoff is a channel that we make. If you were to describe it, it's called a continent catheterizable channel. It's called a Mitrofanoff because of the surgeon who invented it, who was a French pediatric surgeon. His name was Paul Mitrofanoff. He first described it in the early 1980s for a young man who had a lot of urethral surgery, whose urethra had been destroyed by that surgery and had no other means of emptying his bladder. We make them now under a range of different circumstances for people who have all sorts of bladder and urethral difficulties. We make it primarily out of the appendix if it's available, because that seems to work best for everybody that's tried it. There are other ways of making a Mitrofanoff using little bits of small bowel that we reshape. We plumb those into the bladder. We bring them up somewhere on a patient's tummy, most commonly to the tummy button, but sometimes on the right-hand side. And that allows somebody to insert a catheter when their bladder's full, to drain it out, then remove the catheter so that they empty their bladder. They're left with an empty bladder, but they don't have to wear a catheter all of the time, and they don't have to wear a stoma bag on their tummy all of the time. Those would be two of the big advantages of a Mitrofanoff. There are some downsides, there are difficulties and complications associated with it, and for anybody that's thinking about having a Mitrofanoff, it's really important that they spend time with their surgeon, gathering information and making sure that they're happy with the pros and cons of the procedure. There are a range of conditions for which we would think about using a Mitrofanoff. It's usually part of a list of alternatives that people can think about when they come to having reconstruction, but the specific examples would be if the urethra, the tube that normally empties a bladder, is either absent or badly damaged, and therefore there is no other way of emptying a patient's bladder, then the Mitrofanoff is a useful way of creating a channel that a patient can catheterize and empty their bladder. If a patient has to have their bladder removed for any form of disease process, whether that's cancer or something else that has affected their bladder, then we can create a new reservoir for them made out of bowel, and one option in terms of emptying that bladder may be the creation of a Mitrofanoff. That comes in a context where patients may be offered a range of different things alongside that for them to think about, but Mitrofanoff comes as an option as part of that. There are also situations where a bladder doesn't work properly and we want to make it bigger with a piece of bowel, or it's a bladder that's big enough but just doesn't empty, where plumbing in a channel like a Mitrofanoff channel to help somebody drain that bladder is useful and important for them. And so those would be the three major sets of reasons why we'd use a Mitrofanoff. The importance to a patient of a Mitrofanoff is that they can empty their bladder, they don't need to wear a catheter all the time, and they don't need to wear a bag all the time. It is part of a set of options that a patient needs to think about and explore when they're facing that kind of surgery. There's a whole range of patients who have been extremely happy with Mitrofanoffs, and there's a patient support group called Mitrofanoff Support that are really fundamental in giving patients information about Mitrofanoffs. There are some real success stories. There are also clearly people who've had difficulty with Mitrofanoffs. We are as careful as we can be in putting people forward for Mitrofanoff surgery, in trying to make sure that we think that's right for them and they also agree with that and think it is the best option for them and their care. In order to make a Mitrofanoff, it's usually an open abdominal operation. It may be something that develops as part of robotic surgery with time, but at the moment it's usually an open surgical procedure. There may be other parts to the procedure that are going on, such as making a new reservoir out of bowel or expanding a bladder with a piece of bowel. But in essence, the Mitrofanoff involves separating the appendix from the cecum, which is the very beginning of the large bowel. The appendix is vestibular, it doesn't have any function in mankind. We take that on its blood supply and we check to see that we can pass a catheter through it. If we can pass a catheter through it, we'll just take the blind end of it off. That allows us to plumb that into the bladder. We make a special tunnel for it that creates the valve that keeps the Mitrofanoff dry, and then we bring the other end out to the skin. Normally, I tend to keep a catheter in a Mitrofanoff for about 6 weeks while it heals and settles into place. And after that, our specialist nurse would work with whoever has had their Mitrofanoff to activate the channel and get it working for them.